People are fearful that they are going to mess up Medicare enrollment and end up with penalties. Let's talk about the different Medicare enrollment periods. When it comes to Medicare enrollment, I want you to think of two main categories. You have the enrollment periods where you have not ever enrolled in Medicare, and then you have enrollment periods where you're already in Medicare and you have the opportunity to make changes. So before I start and go through them, you see a lot of abbreviations behind me. I've had people yell at me in the comments before, don't use abbreviations. I didn't make these up. These are actually the way these period of times are called. But I will also tell you the full name, and then I'll go back to the abbreviations. So let's start with this side of my Medicare whiteboard. So you're 64 and a half and you have never been on Medicare and you're starting to try to understand the rules. And so I'm going to talk to you as if you're that person and understand how these periods of time work. So you're approaching your 65th birth month, and what's approaching for you is what's called an initial enrollment period. That's your IEP. I'm going to use IEP going forward. So what that is it's a 7-month window surrounding your 65th birth month. So what's going to happen is if you're not already taking your Social Security 6 months before your 65th birth month, then you're going to have to take steps to enroll into Medicare. For those of you taking it 6 months before, you will be automatically enrolled, and then you'll have, for your 65th birth month, and then you'll have to decide if you want to keep it. So the 3 months before your 65th birth month, your 65th birth month, and then the 3 months after. And that is the same rule for everybody, and obviously the period of time surrounds their 65th birth month. So what happens is that most people are going to sign up during this time period, but there's some of you that don't sign up during that time period because you're still working and you have group coverage. So you may not sign up during your initial enrollment period, and I know you're worried, well, if I don't, I'm going to get a penalty. But if you are eligible for the next one, which is called the SEP or a special enrollment period, then you're not going to get penalized. So let me explain. So the special enrollment period, or the SEP, is something that is, I guess you could say, special to you. The timing of it is depending on when you're going to retire. So you're one of these people that, hey, at 65, you're still working. You're in a company that has 20 or more employees. So you've decided that you're not going to take Medicare. You're going to keep your plan. By there being 20 or more employees, your plan is primary to Medicare. In other words, they're responsible for your claims and processing and paying most of your bills. And you're at this company, so you don't take Medicare. And so now you decide it's time to retire. There's certain documents you have to file to show that you earn this, that you have a special enrollment period. But when you do apply, it's going to be based on your timing, special to you, and you will start Medicare without penalties. And again, based on your timing of when you're retiring, leaving that group plan. And by the way, those of you at a company with 19 or less employees, you also have a special enrollment period, but the problem is your insurance, when it's with a smaller company, is not primary to Medicare, and you do not want to get yourself set up that way unless that company agrees in writing that they're going to remain as your primary payer. So now let's talk about the GEP. That is a general enrollment period. So what is that? That is a position you don't want to be in. That's somebody that typically missed their IEP. They did not have an SEP, and now they have to enroll during this general enrollment period. That is a set amount of dates. That's January 1st to the end of March every year. So that's a time period where if you messed up and you didn't sign up, that you have the opportunity to start Medicare. So if you sign up January 1st, you get to start February 1st. Whatever month you sign up in, you get to start the first of the next month. And you do not want to miss this period of time. If you don't do it by the end of March, you're going to be locked out of Medicare a whole nother year until the next Medicare GEP on January 1st. So again, giving that, the overview, these 3 time periods are for people that were never on Medicare and they're figuring out the right time for them to enroll. So now let's switch to this column. And I know there may be some additional enrollment periods, but these are the two I am addressing. So now you're on Medicare, and every fall you see a million commercials about Medicare and all the different plans. That is the Medicare annual enrollment period. That is the time of year where you've already done this, and now you have the opportunity during this to make changes to your current coverage. That specific time period is October 15th to December 7th. That is the time of year where you can change your drug plan. And it becomes effective January 1st. You could change your Advantage plan. You could go from original Medicare to Medicare Advantage to original Medicare. Of course, if you're going to do that, just know that during the Medicare AEP, you can get into original Medicare, but you're not guaranteed a Medicare supplement policy. Typically in most states, you have to qualify with your health. Some states you don't, so you have to look up or ask me to look up whether your state falls under that category. But the point being is, just like your work now, every year your employer comes to you or through the marketplace and you learn this is the time where the new plans are being introduced, and you look them over and you decide what is going to be your coverage for the next year. That is the Medicare AEP. And that's an important time of year. It gives you the opportunity to make changes for the next calendar year. The last period of time I want to talk to you about is the Medicare Advantage open enrollment period. Again, sorry, my dog is barking. This, you've already enrolled. You're in some sort of a Medicare Advantage plan, and you realize in January you don't like the plan. You have till March 31st to make changes. You can switch Medicare Advantage plans. You can even try to go back to original Medicare, but you will typically have to be underwritten if you're going to try to get a Medicare supplement policy. And during this time period, you cannot switch your drug plans. Whatever you did with your drug plan is done. Last opportunity to make a change is December 7th. Of course, if you're in a Medicare Advantage plan and you're going to go back to original Medicare, then you can switch into a drug plan, because if you're going to make that switch, then you need a drug plan. So bottom line, when you take a look at this, is a lot of people think with this AEP that it applies to them as they approach Medicare, but it has nothing to do with you until you are in Medicare. So that is Medicare enrollment, kind of an overview of it. It can be very confusing, and that's all I got.